Hello, my name is Alejandra Lopez, and I will be showing tricks to knowing the cranial and facial bones and their locations as part of anatomy and physiology course. Before we begin, a good way to understanding these bones and their parts is by drawing them out and see if you can know what it looks like without having to look at an image. Or if you do not like drawing, you can always copy out some images of the bones and test yourself by seeing if you can identify the key structures without looking at a labeled model. Starting off with the cranial bones, a mnemonic you can use for these bones is stop, extra, flight. So S is sphenoid, T is temporal, O is occipital, P is parietal, E from extra is ethmoid, and F from flight is frontal. So stop, extra, flight. You can draw out a skull to help you know where they are. You can also use an image. Now, for the frontal bone, its location is in its name. It's at the front of your cranium. Also, frontal sounds like forehead, so you know it will be this front part. Then parietal sounds like pair, so you know there will be two of them, and the word parietal actually means wall, so you know they will be the walls of your cranium, a pair on the sides. Occipital means is at the back of your head, and that is what occipital actually means. But you can also think occipital kind of sounds like and looks like occupy. And when you have a crush and see your crush occupies the back of your mind, because at the back of your brain is where your visual processing is. Then temporal sounds like temples, so your temporal bone is at your temples. And you have two temples at each side of your head, so you will have two temporal bones. Sphenoid partially means sphere and sounds like it, and your eyes are sphere-shaped, so you know sphenoid bone will be mostly behind the eyes or called the orbits. Also, if you are looking at the sphenoid bone on its own, it looks like a butterfly with its structure called the greater and lesser wings. Just like a butterfly has wings. Lastly, ethmoid bone, you can think it sounds like enclosed, so it's the most enclosed cranial brain, the deepest back of the orbits and the roof of the nasal cavity. Next, we have facial bones. You can draw out a skull to help you learn the parts of it, or you can just use an unlabeled image. First, mandible. Mandible bone sounds like mastication, which means chewing, so you know it's your jawbone. Then maxillary sounds like maximum, so you know it will be taking up the maximum space on your face, and be max to your mandible, meaning greater above your mandible. Then zygomatic means cheekbone, so you know it will be at your cheeks. Nasal means nose, so you know it will be your nose bridge. Lacrimal means tears, so you can know it's where your tears drop from, medial to your eyes or orbits. You can also think lacrimal sounds like lack, so when you lack happiness, you cry tears. Then palatine bone. Palatine comes from palate, so you know it will be at the back of your palate, the roof of your mouth. Vomer bone, I think, looks like one of those portable vacuums, if it were to be very thin, so you know how it would look like separating your nasal cavities. Lastly, inferior nasal concha. Inferior means below, Nasal means nose, and concha means shell, like a sea conch. Therefore, you know it will be at the bottom of your nose looking like a shell. And that was the cranial and facial bones. Another way to help you know these structures is to use yourself as a model because you have these bones within your face and head. So see if you can identify where these bones are on your own body. Another way you can use yourself to help you learn the cranial bones is to take your right hand, coming from the back of your head, and place your right hand on the top of your head, with your fingers pointing towards your face. Where your palm lands, that's the parietal bones. Where your thumb lands is one of your temporal bones, because you know we have two on each side. Where your fingers land is frontal, and where your wrist and arm lands, that could also be referred to as where your other than your hand lands. So your other lands, which is where your occipital bone is. I hope this helps you in your studying. Thank you for watching.